Thank you very much for joining me for this session of Dr. Plotzker's Mind. It's good to have a patient portal. I've been on the patient portal, been on it quite a lot. We'll be on it some more next week. It's been something of a woolly encounter with medical care. At my last primary visit, my doctor always recommends getting some lab work, usually very appropriate lab work. Something came up not quite right. I saw it first without getting into what the test was or what it showed. It is one of those things that can get patients into a rabbit hole of getting treated for things where the treatment has risk, but the disease itself does not justify that risk. There are a lot of things like that. The colonic polyps would be one. The PSA would be another. Um, an abnormal or borderline TSH, thyroid nodule as an incidental finding on an ultrasound done for another purpose. These are not quite life-saving, whereas some incidental findings, such as an early mass in the pancreas on a CAT scan done for another purpose, could be life-saving. But some of these tests reflect very indolent conditions that evolve over years, if they evolve at all, and can get people poked with sharp instruments, radiated, and put on lifelong medication. So I found myself with one of these tests. At least it was not incidental. It was a test ordered as health screening, though some controversy as to whether it should be. And the abnormality had to be followed, which got me biopsied and now diagnosed. One of the offshoots of the patient portal, at least for medically sophisticated people like me, as I'm a retired physician, I can read the report. And doctors who are already overworked don't have to crowd out time to call me back. Usually I call them. And sometimes I don't even do that. But now I have a full diagnosis. I also have a doctor handling this who is more expert at it than I am. So I will go back to the follow up visit, at least understanding what I have, and all ears for his recommendation on how to proceed. There are a number of problems with these incidental findings. My most familiarity is with thyroid nodules. There is actually a recommendation from the United States Public Health Prevention Bureau not to look for them, to the point where they said don't even examine the thyroid because you might put your fingers upon something that makes you do more. But it's hard to avoid things like a carotid ultrasound or a directed ultrasound if you do a palpation and feel something, since you're probably obligated to find it. I sometimes wonder about how many people get various types of treatment that they don't benefit from, though um, fortunately little of it is harmful. Taking somebody's thyroid out because you can't tell if the needle biopsy was benign or not uh, is not a totally harmless thing to do. Nor are incessant colonoscopies for 1 centimeter polyps, uh, which bring you back to another colonoscopy 3 years later instead of 10 years later. So, yes, there are rabbit holes. It's good to avoid them, but some things do have the potential to be serious. So avoiding them is not always the wisest decision. Mine is done. My follow up appointment is next week. I have an expectation of the advice. If it's different than what I expect, I will ask the appropriate question. But for now, I appreciate being the first one to know what I have. Thank you very much for sharing this session of Dr. Plotzker's Mind.